All right, we're going to go ahead and get started. Before we get started, I would like to let everyone know that this is being recorded, so we will be able to share this with everyone and be able to forward that out later on, either today or tomorrow. So, with that being said, we're going to go ahead and get started. My name's Cory Eslinger. I'm a Missouri Advanced Prevention Specialist with Preferred Family Healthcare, located here in Kirksville, Missouri, and we cover about 27 counties in northern Missouri, providing resources to communities, schools, coalitions, and focus predominantly on youth substance use prevention, along with many other hats with mental health, first aid, suicide awareness training, substance use trainings in schools, educational programs, things in that nature. At the end of the slide, I'll also show different locations throughout the state of Missouri that have contact information for other PRCs if you're not from the northern 27 counties. So, all right. So today we're going to talk about the game of risk and prevention. So, for those that aren't familiar with the game of risk, this is what it looks like. It's basically a board game that uses strategic planning, methodical navigation across this board, with the end goal being to capture all the locations. And prevention is very, very much related to how this game works. I actually had the opportunity to play it over Christmas. I had never played it before, and as I was playing it, I was like, man, this really relates to how and what we do in prevention, because we have to be strategic in affecting change in our communities that we work in, and in order to achieve our goals, that is something that we definitely have to make sure that we're doing methodically if we want the best results. So when we start looking at moving forward and making change in our communities, we need to come up with a goal, a plan, a strategic plan at that. And we need to know these main things. What is the goal? What do we want to achieve? And why do we want to achieve it? A lot of the times we start things in communities in our daily lives just because, or others are doing it, or there's usually a reason or a cause or something's going on of why we start doing things ourselves. And this is where we need to hone in on that. We need to know why. Why do we want to achieve this? Why is this so important? And then also we need to double check and see, do we have things in play that we know will check our work? So know if it's impacting what we wanted to change, our goal. And who do we need to target? We need to know who our audience is. A lot of the times we start doing things and, like, we call it willy-nilly, just doing things as we see we need to. And a lot of the times we end off in very many different roads, branches, and the strategic plan kind of helps hone that in and make sure that we stay on track. And so, where are we completing the goal? This is very important as well, knowing our geographic region or our community, however we define that, whether it's a town, a county level, multiple towns, multiple counties, as we have a lot of diversity within these different communities and these sectors. And then, when will you know it's time? And in other words, how do you know if your community is ready to accept change or start working on change? And this comes with buying, media coverage to get word out, educate, and also building capacity at your local level, getting those key stakeholders involved in the community, whether that's a sheriff, a lawmaker, a council member, religious or faith, depending on the community that you're in, who has the biggest chances at impacting change in that community. And we do this by developing a framework. We kind of take everything that we just talked about and put it into some type of framework and develop a plan, develop a strategic plan. And all these frameworks can look different. For prevention, we use strategic prevention framework, business model, and there's many out there. As this example here shows, there are many different maps, but they all serve the same purpose. They all will get you from point A to point B. And no matter what kind of group you are, what community you're in, having a roadmap to navigate these ups and downs, the goals, how to complete them, is key, because that's going to show you direction, that's going to give you a way to measure your outcomes and know if what you're doing is in fact working. And I like to point out on this that sometimes we overlook individuals in our community because they may do things slightly different. But a lot of the times these are missed opportunities in order to bring them in and have a seat at the table. Just because they do it differently doesn't mean that we're not working to achieve the same outcome. And sometimes that's what it takes, is that outside the box thinking or a different lens to look through to try to solve the problem or complete a goal. Now, in prevention, we have, what do we do? Somebody will ask on a regular basis, what is prevention? What do you do? How do you define that? And in risk, I had this question earlier this morning, what is risk? What's the objective of it? So going back to the game analogy, your idea is to load up on those entry points. If you're trying to, protect a certain country on the board, you want to load up where anybody might come in. This is kind of like, very similar, we'll show analogy with a vaccine and boosters. Healthcare, we do vaccines. You load up on that entry point, give the vaccine, and then you have boosters throughout your years as you grow up. Those are your backups. You have somebody on standby behind there in case they do come through, and it's there to kind of help secure what you're trying to do. And with anything that we do, take your time. Try not to rush anything. It's a slow process, and it's designed that way to make sure everything is covered. And in prevention, we reduce things, change things, and avert. And that's usually the process in which it goes. A lot of the times, we have to assess our community to ensure that they're ready for a change. And that may start with reducing youth tobacco use or youth alcohol use. So how do we do that? Well, we need to start changing, our environment, start changing the community norms. And then eventually, not right away, years down the road, the goal objective would be that that behavior is averted and is no longer doing it. So it takes time. We can't just go in and ban, alcohol or tobacco in a community, because kids are still going to find ways to get that, whether it's a neighboring community or a friend or a family member or a peer. So being able to do slow changes for the end goal to be a better outcome. And we can do that by different strategies. This is pulled from CADCA's website. It's the 7 core strategies, everything from provide information, build skills, provide support, change access and barriers, change consequences or incentives, change the physical design of the environment, and then last and most certainly probably the most important here is change policies, rules, practice, and procedures. And they can be found at the website there at cadca.org. I also have in the files here down below, these are all the CADCA primers that cover different aspects of the strategic prevention framework that we use. Several different points and pieces here covering assessment, planning, sustainability, and also talks a little bit more about community coalitions and the impacts that they can have. You should be able to click on those and download those for your own use. And then I also have a web link that I'll launch later that just takes you directly to that website, so you can see all those as well. But so we're going to take a look into these strategies and dive in a little more on where we use these, how we use these, and what we tend to see more so than not. So as I mentioned earlier, vaccines and boosters. With public health and physical health, we have people that will go in and get vaccinations for school. Most of the time, you have to have vaccinations to get into a certain grade, and so on and so forth, and then have boosters throughout the years. Well, we look at these 7 strategies, and of these 7 strategies, what would be considered a vaccination, so to speak, and which ones are considered more boosters? Well, when we look at what a vaccination does, it is geared to reach an overall population or an entire of a population. So out of those, the ones that do that, the only one that actually addresses everything and below is our number 7, change policy, rules, practice, and procedures. So if we implement this, it's going to affect community, organizations, relationships, individuals, everything basically below that within the circle. Now, everything else, not to say that it can't be implemented at an individual level. This is just what's common in the realm of prevention. So when we look at, changing consequences and provide support, provide information, we usually do that at organizational levels. Um, that could be a health fair, that could be at schools, that could be at a chamber of commerce meeting, going to our coalition meetings and doing that. But it's embedded at those organizational levels in hopes to reach your families, social networks, and other individuals within the community. However, ideally, we could also do those at a community level, but typically we're doing those at an organizational level. And then changing the physical design of the environment and changing access and barriers typically happens at a community level. Not to say that consequences and incentives can't be done at an individual level or at the home or things in that nature, but for the most effective change, it's going to happen more at a community level. So, you have a youth that's going into a retailer and buying tobacco or alcohol at a gas station. What can you do to change that? Hang up signage. You can increase law enforcement, that enforcement aspect of, what's going to happen to the retailer that's selling. And this is really key because these are all things that can affect change in your community, and a lot of the times different coalitions are doing things differently based on their community. Unfortunately, we always have to find ourselves choosing between thin or heavy, meaning, do we spread ourselves really thin and try to do all these things, such as provide information or change consequences? And as you can see over on the right side of the map, you have a whole bunch of ones. So you have one individual on each one of these areas trying to tackle this. Or do we want to do things more kind of like the Greenland, Iceland area up at the top of the page where it has 11? Group effort to affect change. That way not one person's doing the sole work. This is going to be the most effective when we work as a team or a coalition to affect change overall within our communities, changing laws, changing policies, and things in that nature. But a lot of the times we see a typical coalition that's spread really thin or only has one person doing all the work. And we really try to avoid that, as that causes burnout, and retention levels are very low on keeping people in those coalitions, as well as completing goals and objectives. If we're not completing those and being able to celebrate the little wins that we have, it makes it really hard for coalitions to continue to do work or attempt work. And then we have, inevitably, our biggest struggle yet, nature. So going back into psychology a little bit, when we look at how do we plan for things, how do we do stuff, who are we, where do we come from, why do we do the things we do, we start looking at nature. And I like to call these our lovely risk factors. It's stuff that we can't control that maybe was passed down, whether it was inherited or genes, the makeup of who we are. Our personality, and some addiction traits have been traced to be inherited from family members or certain genes. And so these are things that a lot of the times as coalition members or in communities we can't really change, but they may put these individuals at higher risk for substance misuse, mental health concerns, things in that nature. So we have to be aware of those when we start picking strategies or understanding what our community needs to move forward. The opposite side of that is our nurture. And I like to look at these as protective factors. These are things that we have influence on, such as environmental factors, peers, influences. And this can be a peer, family, community influences. You know, those that grow up in communities that are supportive of the youth and the youth feel like they belong. Huge protective factor for them. Feeling close to one individual, trusted adult, mentoring, things in that nature, depending, and that's a cultural dynamic within that community, which is our nurture. And this kind of helps contribute to who those individuals are, such as our youth or young adults. So we look at what can we do as a vaccine. We showed you the chart earlier with the circles within the circles. And we need to know, okay, what can we do? What is considered a vaccine? We went to a training here not too long ago. It was a policy meeting training. And Andrew Romero, director of GEA, or the Geographic Health Equity Alliance, and he was able to share lots of great information, and I have taken some snippets from his presentation just to share because I really like the way that it was presented and the pictorial images that go with it. So on this one, a vaccine, we're looking at, and this focuses on tobacco, tobacco price increases, whether that's a sales tax that's initiated or a countywide smoke-free policies, and then also the access. A lot of rural areas, access to care is detrimental. So whether it's looking for transportation pieces to make sure that they have, or ways such as teledoc that can come in and work in these communities to get individuals access to care. And then last but not least, our media campaigns. So this can be traditional media such as radio, TV, local news outlets, newspapers, and then also our more traditional social media outlets. Anything that gets media and the word out. So we can be pushing media campaigns about information of why we need to increase tobacco prices, or put a tax in play in our local community to increase these tobacco prices. And knowing those are the big things overall that's going to affect the local policies or conditions in those areas that you're in, whether it's state or federal level. Oh, I have a little, try to get this back real quick. Technical difficulty there. There we go. And so after we implement those policies or environmental changes that we're looking at, what are some things that we can do, whether it's at a coalition level or local, more localized level, that's going to kind of feed off of those bigger policies, right? So Tobacco 21, even though that just went through as a federal mandate, um, this was something that was done before that, but being able to change those at a local level, or having certain gas stations um, or convenience stores, or even like Dollar Generals and Walmarts and places like that that still sell tobacco, being able to implement that and stand behind the bigger policy change. Smoke-free multi-unit housing. You can also look at tobacco-free colleges, um, and then restrictions on flavors, alternative pricing policies, things in those natures that's more localized. It's even though we may have a policy in play at a local level, then we can put these into the smaller communities that kind of back those up. Rather, it's signage, just getting the information out there. Um, for example, we had one that, you have smoke-free parks. Well, if you don't have any smoke-free policies in your community, it does no good to hold and put up the signage because there's no enforcement behind it, right? And that's key, because a lot of the times in prevention we do these smaller boosters, so to speak, and then there's nothing above that that kind of controls it, right? So there before, tobacco prices and alcohol prices, I think due to legislation they've kind of locked those in where we can't mess with the price of it. But there's other things that we can do, such as raising the legal age and doing things in that nature that limit access to youth. And that's our biggest goal, right? Looking at the picture, there's restrictions on flavors. Um, they've just put out policy that they're banning flavored in the pods, Juuls. And so a lot of places are following suit and starting to have those pulled off the shelf. Um, but it's one of those, we implement the policy and then be able to follow that up with local targeted things that can be implemented or enforced. Enforcement is a huge thing when it comes to implementing things at a local level. It's great if we have them, but if we have no enforcement to back them up, then they're just as good as that enforcement. So going back to this, when we look at our vaccines versus boosters, your vaccine, or the ones that's going to reach everybody, as I said before, is that number 7. Anything that we can change at a local, state, and federal policy and laws um, is going to be huge, because in that way, if we have those policies in play, they're going to affect everybody, community organizations, relationships, and individuals in that community or that area, the state that they're in. And ideally, we need to get around to using those kind of rules of thumbs when we work in prevention. We can provide information and we're really good at it. But in the big picture of things, is that causing the best change in our community? Is it impacting the most? And as we look at it, it's only affecting the lower portion of who we're trying to reach. And so in order to affect change in a bigger scheme of things in that community, we need to really focus on things that are affecting policies and systems and community in order to make a better change or more effective change where we're living or where we're working at. We're going to see the best results there. And we can use those evidence-based practices and programs very easily to implement these to make them effective. So, what is your next thing to do? We've watched all the information that I shared, and a lot of the times we watch webinars and it's like, okay, what now? And so I ask you guys this: what is your next move? A lot of the times we try to leave webinars with some type of information gained and something to impact change as we move forward. The one thing that I can encourage you is really take a look at what type of strategies, what type of efforts are you doing at your local level, whether it's coalition work or partnering with organizations, and what type of things are you doing? What type of strategies are you implementing? Are they more geared towards individuals? Or are we affecting community change by changing some policies and rules and then implementing smaller things that can be enforced based on those policy changes? And sometimes, yes, I get this a lot. A lot of policy change is difficult because you have to have lawmakers, whether it's local, community level lawmakers or state legislation, on your side and believe in it. And so I really encourage you, if you don't have those people represented on your coalition or your group that's meeting, to really reach out to those individuals and invite them to be part of that. That's where you're going to get the biggest change or most effective change when it comes to implementing a policy or changing a policy or even understanding a policy. One thing that they really stressed is check your local policies. If you're wondering, hey, do we have a smoke-free ordinance? Well, look at it. What is the local statute? If you have one, what's it say? And is it being enforced? Or is there gaps in it that allow it not to be enforced? And do you need to revise that policy? So that's what I'm going to say should be your next move. Moving forward, look at your local policies and evaluate the strategies that you're currently using and see how effective they really are being. So as I said earlier, I'm going to share with you local PRCs. So we are in the bottom left, preferred family health care, located in Kirksville, but that's all the counties that we do cover. And as you can see, the other PRCs across the state of Missouri are all in different locations: Kansas City, St. Louis, Cape Girardeau, Poplar Bluff, Springfield, and Clinton, Missouri, Kansas City. If you're in those areas, reach out to your local PRC. This is just designed to be very brief, educational, and if you have questions, comments, you want to do something different in your communities, reach out to your local PRC and see how they can help. A lot of the times, as I said at the beginning, we wear many hats. So even if we may not provide it, we may most likely know somebody that does or can get you in contact with or find out. And that's something that I'm always letting people know, if you're not sure where to turn, reach out to me first and see if we even offer it, because we very well may. And if not, I can find you somebody that is doing that or can help with that situation. So, all right. Well, I want to thank everyone that was here. I'm going to open up 2 links for you. One is an evaluation. It just kind of gives us feedback to know how our webinar is, if it was beneficial, and if there's anything you'd change about it. Our next webinar is on February 26th. The topic for that is marijuana, and so we hope to see everyone out for that one. And then my contact information is there below with my email. And thank you all, and as I said, I'm going to go ahead and launch up our evaluation, and we'll give you the website for all the CADCA primers that I have there in the files that you can feel free to browse through. And if anybody has any questions, feel free to use the comment box or the chat box, and I will stay on here just for a couple seconds in case you have a question that needs answered. Thank you.